Richa, thank you so much for taking out the time and sharing your knowledge with us. I think it's a very important session we're doing today. And yeah, over to you.
Thank you, Richa. Thank you for the wonderful introduction and the welcome. And yes, like you've rightly said, it's menopause has been a taboo. I think periods or menstruation itself is a taboo in. I wouldn't say in our country. I would say all over the world. And that's why I thought of talking to everyone about why don't we talk about menopause. And I've gathered together some slides. We'll discuss a bit about menopause. We'll also discuss why. From various conversations I've had with my patients and what I've heard from them, let's also discuss why people really don't want to talk about menopause or menstruation. So can you share the screen so that everyone can see
Yeah,
the presentation as
yes,
well?
yes.
So
Let me just share my screen.
yeah. So to begin with, we have all of these words are like taboo words. Be it periods or vagina, vaginal health, and menarche, puberty, periods, menstruation. All of this is not spoken about. And I remember we had a kind of a orientation when I was in school. Back in school, we had an orientation with teachers and the parents and us girls together. And that time, some parents had asked, some mothers had asked the question that my daughter comes home and she's having pain because of her period. So what do I tell her father at such times when she's sleeping? So why can you not discuss menstruation as a regular thing with her father? I mean, why does it have to be such a hush hush topic? uh, and why should you keep it why should it be a secret? It's something that we all go through every month, and it's natural. It's extremely natural, so why not talk about it? I mean, I always say this, you go to a shop to buy pads, and if though you feel embarrassed to talk about, say which pads to that male um, uh, shopkeeper, and then he'll wrap it up in a newspaper and he'll put it in a black bag and give it to you, and you carry it home like you're carrying a bomb. So why not? Why can't we have a packet of pads in our hands and walk back home? But no, we don't do that. There is this taboo around all of these things that exists in our society, and I think this taboo kind of exists everywhere. It exists, I think, all over the world. And that's why people really need to open up and discuss these things and talk about these things. Can you have the next slide, Richa? So then, like I said, I spoke to a lot of patients. I keep speaking to a lot of patients. So I kind of asked, I mean, this is what I gathered from why people don't talk about menopause, or why women don't talk about menopause. First of all, I think this is some घिसा pita line that we keep on hearing. But women are used to suffering. ये होना ही है, ये दर्द होता है, नहीं ठीक है वो तो होता ही रहता है. That kind of thing is always there with us women. And it's always the family first, the husband first, or the kids first, kids especially, and then it's yourself. So you first look after your kids, and then you think about yourself and you look after yourself. So it's always कि पहले उनका देखने दो फिर मेरा देखेंगे kind of a thing. So we are always used to placing ourselves second. Forget how others think of us. Then one a recurring theme that I heard from patients is that they didn't know whom to talk to. You talk to your family members and they say, यार ऐसा कुछ नहीं होता है. You don't want to get up and you feel tired because you are being lazy. तुम्हारा वजन बढ़ गया है, तुमको exercise नहीं करना है. And it's like no one can understand you. Talk to your, I mean, if you go and talk to your colleagues at your office, people will kind of, अरे उसको सब menopause problems है, उसको अच्छा project मत दो. So you don't want to discuss this thing with your colleagues at your office, because you want them to look at you as, a strong woman who can handle everything. And that's how, come I mean, sometimes, we have this Women's Day on 8th of March, and the commonest messages we all get is like that, a woman with multiple hands and managing and juggling multiple things. I mean, why do we want to be like the multiple manager and taking care of everyone? but that's how we've always been. And very often, even if you can talk to somebody, you don't know that solutions are available. Typically, people are told that कि हाँ ये menopause के time पे होता है, ये तो हो जाएगा, थोड़े साल के बाद आपको ठीक लगेगा. And most, I mean, it's not that people don't want to take you seriously. It's not that they don't feel you're important. It's not that they want to keep you second. But very often, people don't know that this happens. People don't know that yeah, menopause can be so troublesome, that you can have these many issues around menopause. So this kind of awareness about menopause and periods and all this is unfortunately not present. Luckily, if you see, this awareness is increasing around puberty, it's increasing around pregnancy. So the one of the best changes we had in our country was that the maternity leave was extended from 3 months to 6 months. So I mean, one side पे WHO is telling कि यार you have to exclusively breastfeed for 6 months, and 3 महीने में अपना ऑफिस चालू हो रहा है, तो how will we breastfeed exclusively for 6 months? But yes, at least that was taken into consideration, and now we have 6 months ka maternity leave. So at least we are able to take care of our kids and breastfeed them, and and recover ourselves also, really. So these changes are slowly happening, is what I would say. People are slowly getting aware of, being aware of what pregnancy is, what motherhood is, and that it's not easy. It is really difficult. So it has come to that point of motherhood, but it has not yet passed on to the time of menopause. And I hope we all start talking about it, and we kind of normalize it, and we also support others, support other women in this journey in their menopause. Because typically, if you say why your family members maybe don't speak about it, it's because, I mean, your husband will say मेरी मम्मी को तो कुछ नहीं हुआ, तो तुमको क्यों हो रहा है. That is probably because मम्मी ने बात ही नहीं किया, because मम्मी को पता नहीं था कि बात कर सकती है. Your mom did not know that अच्छा, this has to be spoken about, this can be spoken about, this has solutions. But today we do have solutions for so many of these things, and that's why we need to actually speak about it, so that people are aware that yes, we have solutions for that. Can you have the next screen? Yes, this will pass is an extremely common answer that we get. Yeah. So again, why is it so important? Why do we want to speak about it? So if you see the worldwide statistics, our population is increasing, and 2020 we had 3.9 billion women in the world, and in 2050 it's projected that we'll have 4.5 billion women all over the world, and out of that 1.65 billion are going to be 50 plus. So they're going to be either going through menopause, or will be going through menopause, or have just gone through menopause. So it's like a huge percentage. If you go ahead and see the Indian statistics also, that's also like a huge number. Can you see the next slide, Richa? So if you see the Indian statistics also, 2020 had like what, 662 million, almost 663 million females. 2050 is going to have 800 million females. And 30-40% of these are going to be around that 40 plus age group, 50 plus age group, who are going to be experiencing menopause. So it's a huge number of our population of the world that is going to be experiencing these problems. And why should they go unsaid? Why should we not speak about it? Next
Also,
slide, please.
adding to this, like this is the
Yeah.
first time in India after decades the women population is more than
Yeah, actually, yes, yes.
men.
I think that is also another reason to celebrate, really. So that's a great thing that finally women have surpassed the number of men. And to be just adding one point here, actually speaking, by nature women or females are more resilient. So typically when we have a premature delivery, if it's a girl, it's more likely that she makes it through all of those NICU stay and all of those things, rather than a male child of a premature birth. But unfortunately, it also happens so that if it's a twin pregnancy, and if it's a girl and a boy, uh, we see that it's more, even if the girl can fight it out, it's often seen that the boy makes it and the girl doesn't. So that speaks about the culture, unfortunately, that we have around us. So in spite of that culture, it's really a matter of celebration that yes, women, I mean the female population has surpassed the male population. So well,
Dr. We get
yeah,
a lot of from the community and the women, like generally a very common question is that, what is this age that
yeah, yeah.
menopause happens? There a particular age? So can you talk a little bit about that?
Yeah, so I mean, all of the statistics and all is fine, but people typically and obviously want to know when am I going to have menopause? Why should I know about menopause? So I have 35, 40-year-olds saying that, why are you telling me about menopause? Because, I'm just 40. So when do I actually really need to know about menopause? So that when the answer for that when is that, on the worldwide context, it's the average age for menopause is 51 years, and the average age for menopause in Indian females somehow is 46 years. We don't know why it is so, but studies have been conducted which have shown that the average age of Indian females is 46 years. So we undergo menopause about 5 years earlier than our Western counterparts. Could be diet, could be genetics. We don't know the answer, unfortunately, but that is the scenario. So we do get menopause at around 46 years of age. That's an average age in the Indian women. Yeah, so that's the age of menopause. And how do I know when I will have my menopause? It depends on multiple factors. One factor is your mother's age when she had her menopause. So it is some genetics are involved in that. So when like you might have menopause around the time your mother, maybe your elder sister had her menopause. So there is genetics involved. Of course, also there are studies which show that some stress levels and your lifestyle, what you eat and how much or how or if you exercise or not, all of these are also factors which let us know when which can determine when you can actually get your menopause. Next slide. So again, coming to the point, like, yeah, we have to talk about menopause. Why is it so significant? Why do we need to speak about menopause? So if you look at this graph, in the our age expectancy has increased over the ages. So around the 1900s, people typically lived up to the age of 45, 50 or so, maybe lesser than that. And now today we have people living up to the age of 80, 90. People are completing centuries. So our life expectancy has increased, but the age of menopause has stayed the same. It's not that because our life expectancy is more, we are getting menopause later. No, the age of menopause is typically the same, but our life expectancy is more. So we are spending almost one third of our life in the period of in the period of menopause. So more than one third of your life is actually spent going through perimenopause and menopause, and then finally entering menopause. So it's a huge chunk of your life that you're spending in this time, or in this phase of life. So that's why you definitely do need to understand menopause and learn to manage menopause much better.
Can you stress a little bit about perimenopause as well?
Yeah. So
What are the
somebody also.
symptoms to expect around this time? Because I think a lot of women in our community are in that phase.
Yeah. So I think someone also asked about perimenopause. So
Yeah,
typically,
yeah.
menopause is when you have not had periods for 12 months, 12 consecutive months. You've not had periods. That is menopause. So that can occur at 46 years on an average. But perimenopause is a time period before your menopause, which can last from around 4 years to maybe even 10 years in some women. So if you take the maximum age of perimenopausal phase, which is 10 years, and if you're getting menopause at an average of 46 years, yes, you can be perimenopausal around 37, 38 as well. So perimenopause is the time before menopause, a few years before menopause, and menopause is when you actually don't get your periods for 12 months. And this phase of perimenopause lasts because menopause is not like a one time event ki, हाँ, 12 महीने period मतलब आज one fine day your period stopped coming. So unfortunately it's not so. So there are a couple of symptoms that you keep on feeling, or you start feeling in this period of perimenopause. So let's look at these symptoms. Can we go to the next slide? So what symptoms do you feel in your menopause? previous to your menopause. So all of these things, you have hot flashes, you have mood swings, you have headaches, you have hair fall, you are tired, you have vaginal dryness, you have joint pains, you can't sleep. So all of these things affect you around your perimenopause and menopause age. So why do these things happen? Is it because of the hormonal changes that happen around your menopause? So you have your hormones, the hormone called as estrogen, that starts going down around your menopause and perimenopause, because of which you start getting these symptoms of menopause. And I mean, it can be your mood swings could be you feeling suddenly you suddenly feel like crying, you could suddenly feel anger, you feel depressed. uh, it's I mean, you're fine right now, and the next moment you are like, you don't know why you're crying, for what reason are you crying, tiredness, you've been doing so many things for so many years, but suddenly you find that, oh my god, it's evening and I just want to go to sleep, I just can't do anything any longer. Hair fall, I think I have not met any woman who's not having hair fall. So hair fall is like one of the most common symptoms that women also tend to have. Of course, the reason is not just menopause or hormonal changes. There are multiple reasons for that, but hair fall is one of the commonest symptoms that women also have. Headaches. So some women have these headaches which happen before period. So typically, even if you're in your perimenopause, this starts suddenly, that just before you get your periods, you start having headaches, you get a migraine just before your period. So something like that is happening. So we have a poll here. So you could also answer. You can tell us what symptom are you suffering from. So sleeplessness, sleep issues. I mean, I've had patients who said, yeah, I would just sleep at the, I used to lie on the bed and I used to be like asleep, and now suddenly I find that मुझे नींद ही नहीं आती है. I stay awake for such a long time, and I get up at night and I can't get back to sleep. So that is something that's happening to me, and they don't know why that's happening to them. Joint pains, yeah, you have knee pains. Of course, your weight is one reason for that sometimes, but then even if your weight is normal, you still have these joint pains or knee pains, ankle pains. Ankle or foot pains, calf pains are extremely common symptoms around your menopause. Then hot flashes is something which is not much spoken about, but we found that, when people come to us for some other reason, maybe they come to us to understand what menopause is, or they sometimes come because they're having heavy bleeding, and then when you ask leading questions, do you suddenly feel hot, then they say, oh yes, that's also happening to me. So sometimes women don't know that, yeah, this is also a symptom of menopause, that I am that's why this is happening to me. Another something similar to that is vaginal dryness. People don't want to, I mean, they don't know that this is a symptom of it, or sometimes they maybe feel awkward speaking about it. But when I ask the patient, is this happening to you? Then they say, yeah, this is something that I am facing. Similar to that is urinary incontinence. Excuse me. Or leakage of urine. You are laughing, or you're sneezing, you're coughing, and you're leaking some urine. You can't control your urine. When you want to go to the urine washroom, you just have to go right now. Sometimes you leak a few drops of urine before you reach the washroom. So these are so many symptoms that women are being troubled with, or are suffering from. And again, sometimes they don't know that these are symptoms of menopause. Sometimes they don't know that whom to talk to. Sometimes they don't know that there can be some solutions for all of these issues as well. So yes, these are the different symptoms that you can feel around your perimenopause and your menopause. Sometimes we have women who are suffering from these symptoms, who say कि यार मेरे periods तो regular है, periods में तो कुछ problem नहीं है, so how come this is perimenopause? So yes, these symptoms can also affect you even before you start feeling before you start feeling period irregularities also. Can we go to the next slide? Yeah, so that's what we done. What we did right now. So it's a small poll about what you are suffering from, what you are yeah, what you're facing. Yeah, so what can you do for these symptoms? So first and foremost, like I said, awareness, that you need to be aware that yes, these are symptoms of menopause, and this is happening to me because I am in this age group. Second thing is, of course, support. We spoke of that. We do need support from our family members, from our children, from our spouses, from our colleagues, our peers, our friends. We need that support so that we can solve these issues for us, and we can at least discuss these issues with somebody. We definitely need empathy. You don't want to be ridiculed at work that, oh, she's having these problems, so just don't give her that project. No, you need empathy. This is something you're going through, and this is something which every woman is going to go through. So please, you should be treated with empathy everywhere. You need to also seek out for help. So help can be of various types. It could be help that you can take from, I mean, you're not feeling good, you go and talk to your family, maybe your husband, go and talk to your friends, and then you also talk about take or seek professional help. That yes, I'm not feeling good, I'm feeling I'm having mood swings, I'm having some psychological issues. So there's no taboo there again. So it's not that you should not seek help, professional help, from maybe a gynecologist or maybe a mental health expert who can help you to solve these problems, who can give you some solutions in managing all of these problems in this phase of your life. So next slide. So what we will do is, I'm going to discuss 2-3 cases with you. These are real patients who've had, of course I won't tell you their names. So I recently had a patient who was around 50 years old, and she held a very high position in the advertisement agency, industry. And she actually took a break from her career because of her menopause symptoms. So she said, I feel my sleep is such a big issue for me that I can't sleep at night. Then I keep feeling tired and fatigued throughout the day. So if I'm so tired, how can I take my meetings? How can I attend to my clients? How can I do justice to my job? I'm in a meeting and suddenly I have hot flashes, I feel flustered, I feel embarrassed. And that's why she was taking a break from her career, saying that I'll wait till these symptoms pass out. And see, somebody, I mean, this is not what you want to do, right? You are going on your career graph, and you don't want to take a break because of these things, which actually have solutions, for which you can actually take some help. You can take some medications, you can make some lifestyle changes, and you can take care of these symptoms and keep on living your life the way, or keep on pursuing your career the way you've always wanted to. And I mean, typically, this is the age when, you come to a position in your career when you want to go to higher stages, and you can't, and the men can do that, and you can't do that. So why should it be so? You can definitely overcome all of these problems and enter your, like, what you climb your career graph, definitely. So next slide. So what did this lady need? She needed understanding that yes, this can happen to you. She needed understanding and support from her colleagues also, that yes, we understand you're going through this, and we understand, and we can work around it. It's not that you have to take a break from your life where that is concerned. And she needed some solutions to solve her problem. She needed some solutions through because of which she could get over all of these issues that she was suffering from. Uh, Next slide. So another patient that I'd come across was, she was a 40-year-old woman. She was working out of home, and she was having a lot of weight gain. She was having mood swings. Her periods were irregular. So she's like, I don't know. I have to carry pads wherever I go. I can't go out for outings. I can't go out anywhere because I don't know when my periods will start. And I keep on feeling angry at times. I feel sad at times. My clothes don't fit me. I've gained a lot of weight. I've gained a weight around my waist, and I don't know what's happening to me, and I feel so upset about. I don't feel like looking at myself in the mirror. I don't feel like clicking my photographs because I don't like how the way I look. So what does this lady need? Next slide. So she needs that kind of awareness that this can happen at this time. She needs an understanding. She needs someone to tell her that, we don't judge you because of how you look. We don't judge you because you don't look like you used to. We like you and we support you because of who you are. And she needed that empathy from people around her who can understand her and support her. Next slide. Then I had one more lady who was 60 years old, and she had a menopause since last 5 to 6 years, and she was having a lot of tiredness, and she kept on having recurrent urinary infections, and she kept on hopping from doctor to doctor trying to understand कि ये क्यों हो रहा है. So the reason for this recurrent infections was actually her vaginal dryness. So what happens after menopause is that your estrogen levels go down. The estrogen levels are they help to keep your vaginal and your urinary tract mucosa moist. They help you to have a good bacterial army, I would say, inside your vagina, which pushes out other infections. And with your estrogen going down, with the moistness going down, with the lubrication going down, that is why she kept on having these recurrent infections. And we treated her. We did not take her infections. We treated her vaginal dryness, and her infections got treated because of that. So that's how she was like, finally I can, I can pee and I don't feel the burning sensation. So it was something which was related to something else, which helped to solve her main problem of that burning during her when she passed urine. So she needed that knowledge that this is not happening. I mean, like, multiple courses of antibiotics is not what I need. What I need is actually treating my vaginal dryness. And she needed that support and empathy, and she needed professional help here to understand what was going wrong with her. Next slide. So yeah, so 2 minutes of your time, and we want to hear from you, and we've been hearing from you. We've got lots of questions in the chat also. So we'll definitely discuss these questions that we have, and we also, after this webinar, maybe, we want you to actually think about this yourself. We want you to think. We want you to ask these questions to yourself. That, are you assessing yourself often? How are you? Are you feeling good? Are you feeling good emotionally? Are you feeling good physically? Are you able to sleep well? Are you able to speak about your problems to your partner? Is he aware of the symptoms that you're going through? Are your co-workers respectful? Do you need to make them aware of what is happening in your life? So interestingly, in the last webinar that we had, which was also around menopause, and when we had women telling us that please have a webinar for our husbands, even they need to understand what's happening to us. So when it comes from a professional, probably they'll understand that, yeah, what my wife is undergoing she's not acting up. This is something that is really happening to her. She's really suffering from that. So is your partner aware of what you're suffering from? Are you getting the support that you need? Is what we want you to ask yourself. Are you prioritizing yourself? Are you giving yourself the time and the importance that you actually deserve? Next slide. Yeah, and finally the question, which is really important. So do you need help? And if you need help, do you need professional help? Please don't hesitate. It could be help from a gynac, it could be help from a mental health professional, from a psychiatrist, from a psychologist. Please don't hesitate. Please go ahead and try to get that professional help and feel good about yourself. And of course, at ELDA, Richa can tell you a little bit more about how we can help you at ELDA also.
Thank you so much, Dr. Amya, for sharing so much, so many things that are so important. I think all of us have a lot of questions. But one thing that I think you really stressed upon, and I would also like to stress upon, is that at ELDA especially, what we believe is that, every woman has her own symptoms. Every woman's symptoms are different. There are no check boxes that, okay, if you have this, there is a set answer. It is your body. Maybe somebody requires medical interventions. Maybe someone requires a lifestyle intervention. So it totally depends on you, and therefore we stress a lot on diagnosis. And without diagnosis, we don't think that we can, go ahead. And the reason why we have a team of experts is because we want to design a personalized plan for everyone. So as you all know that, this time can be a little difficult, and it leads to sudden changes in the body, and sometimes we don't even understand. And most of the time we are going through something and we would ask, okay, why is this happening? And then we Google it, and then we are even more confused. And that's why you need correct answers and you need a correct platform. And that is why we as Elda have curated this platform, and we are available on all platforms. We are on social media. We have a community on Facebook which you can join. We have an app which answers a lot of these questions. You can take care of a lot of these symptoms unless and until it requires a medical intervention. Things like hot flashes, sleeplessness. We have guided audio sessions on stress management, anger management, and things like that. We have regular classes on fitness classes, yoga classes for mind and rejuvenation. But most importantly, what we believe in is diagnosis and a screening process. So I would like to share my screen and show it to everyone exactly what we have at Elda, so that yeah, so we get something called an Elda wellness screening, in which you get three things, which is basically 8+ diagnostic tests, which include your CBC, lipid profile, thyroid, and more. After this, you get a one-on-one consultation with our menopause specialist, and then you get your own plan based on your menopause rating scale that includes a fitness, diet, and lifestyle plan for you. So this is the screening that we provide at Elda, which is a beginner screening for menopause, and it is rated at 999. And this is what you get in this wellness screening. And after this diagnostics is actually where we and our team of experts will be able to tell you that, okay, this is happening because of this, and these are the changes you need to make in your lifestyle to have a better lifestyle. And we also have a Facebook community. It's called Women of Elda. I'm going to put the link over here. You can ask your questions over there. You can connect to other women over there. And we are available on WhatsApp as well. I'll share all the links with all of you over here. But let's take some questions, since,
Yeah.
on the WhatsApp community, also people have been asking. I think I'll take one from the WhatsApp community, where Bharti has asked that she's having brittle teeth problem and weight gain. And is that related to menopause?
So teeth is something which is kind of, I mean, it's kind of ignored at times when you talk about osteoporosis. So osteoporosis basically means brittle bones, but whatever affects your bones also affects your teeth. So typically, teeth falling off, or having these brittle teeth, that's also one of the symptoms of osteoporosis. So yes, this could be happening because of your perimenopause or menopause. The second thing she said was weight gain, right?
Yeah.
Yeah. So again, weight gain. So weight gain, what does weight gain have to do with menopause? Is that there are a lot of changes in your metabolism which happen around this time because of the different hormonal changes that you're going through. So typically, what happens is, as a woman, you kind of, you typically have wider hips and wider thighs. That is a gynecoid form where of how women typically are most commonly. And what happens around your menopause is your estrogen levels are going down. We also have some amount of testosterone or male hormones in our body. They kind of stay at the same level. So the ratio between this female and male hormones that gets disturbed, and that's why your physique kind of goes more towards the male pattern. Typically, when men gain weight, they typically have bellies. So that's what happens to us also, right? So when we are also going towards menopause, we because of this hormonal change, we also start gaining weight, and that weight tends to be centered around your abdomen or your waist. So that is one symptom of menopause as well. So I think you should definitely go and she should definitely go and get her bone mineral density checked. And in case it shows low density, then definitely she can take treatment for the same. I mean,
So
of
at
course, there
this
could be other reasons for brittle bones, but yes, considering her menopausal age, this is one of the common reasons that could be.
Another great answer, a question that I think is important is that, who is the right doctor to connect with? It should it be an endocrinologist or a
It's an
gynac
excellent
during a
question, I would
very
say. Yeah. So when we talk of menopause, or when Indian Menopause Society also talks of menopause, we want to, we definitely always mean that we say that there should be a multi-speciality approach. So a gynac cannot always give a solution to all your problems. So you need a gynac, you may need an endocrinologist, you may need an orthopedician, you may need a psychiatrist, you may need a psychologist. So whenever we at Elda have women coming with all of these problems, we typically have all of these people with us, and we try to solve the problem by the expert. And that's what makes us kind of different, and that's what helps us to solve all the problems of that women are facing. So as a gynac, I may or may not be able to give you an answer to your orthopedic problems which arise because of menopause. That's why you sometimes do need to go to an ortho also. I may not be able to give you a solution to your mental health problems, or a mental health specialist may not be able to give answers to your gynecological problems. So that multi-speciality approach is something that is really important when you talk about menopause and menopausal issues.
Yeah, I think this is very important. A lot of you are probably going through some mental health issues, stress issues. So there's a reason why we have professionals for each field, so that they can, kind of guide you in the particular direction where you're supposed to go. So another question someone's asked is, are menstrual cups safe to use?
Oh yes, definitely they are safe to use, and it's one of the newest things which is kind of available these days now. It is safe, it is life changing, it is environment friendly, and I mean, I've had patients coming and telling me, "Yeah, I forget I'm having periods when I'm wearing a cup. It's that
Yeah.
comfortable." You
Yeah.
need to definitely take some care, which means you need to keep changing the cup every few hours, so that accumulated blood does not give rise to any infections. You need to clean the cup properly. You need to sterilize the cup. Sterilization can be simply by putting it in boiling water, or boiled, or like very hot water. That is the way you can clean it. Don't use too many soaps and aromatic soaps to clean the cup. But yes, menstrual cups is definitely something that is safe for to use. I also get asked a question by my patients around this age, that can I let my daughter use it? So and especially unmarried daughter use it. So the thing is that if she finds it comfortable, she definitely can use it. It goes and opens up inside your vagina. Typically, with the kind of hectic lives that we are living, and the kind of sport activities that most of us girls, or most of your girls undergo, uh, very commonly they've already ruptured their hymen at times because of some sport activity. So at such times,
Hmm.
they might not find it difficult to use a cup. So if they are comfortable with it, they can definitely go ahead and use a cup. It's not going to harm them, and you are not harming yourself, and you are taking care of the environment also when you're using a cup. So if you want to, please go ahead and use a cup. It's definitely safe.
Also, can you talk a little bit about brain fogging as a symptom?
Yeah, so brain fogging, again, I mean, it's a part of the various mental or psychological symptoms that you face around your menopause. So just as there could be anxiety, there could be anger, there could be sadness, there could be depression, there could be crying. Same way, there could be brain fog. So suddenly women tell me that I can't remember as well as I used to before. Now the thing is that we don't have a medication as such to offer for this problem of menopause. Even a hormonal therapy that sometimes needs to be used for women, that is not recommended specifically and only for this symptom of menopause. So what do you do about it? So research has said that, if you can uh, do things which kind of challenge your mind, which could be a challenging puzzle, or it could be, things like a sudoku, or things like a crossword puzzle. So these things which are challenging your brain, some activities and games which challenge your brain, they help to keep your brain active active longer. So that is one solution that research suggests for that. Of course, other things that also help is, I would say, calming your mind and trying to concentrate, deep breathing, meditation. We don't, I mean, these are the things which we can also do to help keep our mind a little stable and to help us reduce this mind fogging or brain fogging.
Mhm.
We don't have a lot of
Pratibha,
research on this for obvious reasons, but yes, these things have shown to help.
Pratibha actually wants to share something. Pratibha, can you unmute yourself and please share? Pratibha.
I think you have to let her unmute because
Yeah, I
Yeah,
think
yeah.
she's in.
Yes, yeah. Thank you. I'm Dr. Pratibha. I'm a dermatologist.
yeah.
Can you hear me?
Yes, yes,
Yes, we can hear you.
Yeah. I'm 42 years old. I'm in that journey of getting there. I wanted to share with you all one of the thing I heard from one of the senior consultant dermatologists. She is 65 years old now. Since we have been discussing about the effects of menopause and the problems we face during this time, there is also kind of some changes which are happening good during that time, which the consultant madam shared with me. She said she all her life she was suffering with a bad migraine, but at her menopause she got rid of it.
yeah, that can happen. Yes.
So there are kind of some positive side of it, and as we all know that this saga of monthly undergoing this
Menstruation ends.
hormonal
Yes.
fluctuation. Yeah,
Yeah,
every saga comes to an time. So we need to
I think
have a
it's a
very
great point
positive
you've shared, Dr.
outlook
Pratibha.
towards. Yeah, thank you. Yeah,
good.
so since concentrating on the how to tackle the problems, so I
Look at the
wanted
positive
to
side.
all the women to have some. Yes, yes, yes.
Thank
I
you
love
so
this
much.
point.
Thank you
Thank
so
you so
much,
much for bringing it
Dr.
up here, Neha.
Pratibha. Yeah, and
Yeah,
it would be
yeah.
lovely if you can
Like,
join the community also,
Yes,
we would
please, and inspire
love
women
to.
like that this way, same way.
Yeah, I mean, we definitely all of us need to share more and like each other's stories. And yeah, as I said that it's also a time where care is
yeah,
required
he
and
does
celebration is required because you're transitioning into a
Exactly,
new
exactly.
phase where
really
your
Dr.
voice
understood.
Pratibha,
is.
your voice is breaking a bit.
Yeah,
Could
can
you
you
only
hear
pick
me now?
now
Yeah.
this is better, yeah.
Yeah. So it's been like a huge audience today. I think lot of women are here, hearing, participating in this session, and that's the reason I wanted to, have people, women to have a positive
Yes,
outlook.
true, very true, very
Not
true.
dreading towards a menopause, but feeling liberated, kind of. You
Lies.
know.
Right, right.
Yes. It,
That's
of
a
course,
lovely
as you
message.
yeah, as we have all this time discussed, these are all the hurdles, but we can, as you are rightly supporting, we can get through, and there is a beautiful phase after that. Thank you.
Yeah, yes, yes.
Thank you
Well,
so much,
thank
Pratibhaji.
you so
Thank
much.
you so much. Um, but yeah, like there is a solution to everything, and we don't
Yeah,
have to
yeah.
listen at okay, this is gonna pass or ऐसा ही होता है. Suffering is a part of a woman's journey and things like that. And we know that a lot of things is changing for younger women. So let us, change things for our mother, like for me, my mothers, and all of those people, and of course for us as well. For all these things like weight gain or just knowing more about menopause or just getting correct information about hormones,
Exactly.
bone health, skin, hair, emotional well-being, diet and nutrition, we have our app which for which we have designed content in a way where you understand these things in a better manner, and you know that okay, this is happening maybe because of a deficiency of a particular hormone, or so knowledge and spreading, this is how apart from
Totally.
just providing programs and providing the screening and etc, we have made this app specially for this, so that you can spend time over there, you can have answers to hot flashes, you can have answers to skin and hair fall and things like that. So do check out our app as well. I'm putting the link over here for people who are having weight gain issues and things like that. We have fitness sessions and yoga sessions both for weight loss and weight management. We also have an in-house nutritionist who can give you a personalized plan. You can book a consultation with them and understand what is it, that we don't have to do crash diets, we don't have to do
Yeah.
those strict diets. So please check out the app, and definitely, and also please join the community on Facebook, because a lot of times our experts share tips and you can ask. We have AMA sessions over there and things like that. But anything that you think requires a medical intervention, please go to a professional expert, and please don't rely on Google. Please don't rely on Quora for answers. It is your
Yeah, yeah.
body, and it is very different from someone else's body. It does not tick mark a particular symptom and all of that. Please don't take any kind of supplement or any kind of medical, without any expert telling you. And diagnostics is very, very important. So do check out the wellness screening. It is going to provide you at least a basis, a beginning towards something that you can gift yourself that. And that's why we've kept it at a very nominal fee, where we are
Yeah,
providing
actually.
a beginner's screening. Um, yes, so excessive dryness, hair fall, and all these things. I
So
think
I
you'll
think
find
I
a
like
lot
to,
of solutions in the app
yeah.
for all of this. And yeah, if anybody has any other question, please join the community, and you can put your questions over there, and our experts definitely answer those things. Sorry, we don't have a lot of time for a lot of
Yeah.
questions.
So I'll just speak about these two, three things. One is that, like you said correctly, that I mean, your body is your body. Your body is not a machine. So, unfortunately, 2 plus 2 may not always equal to 4 where medicine is concerned. So, what may suit your friend may not suit you. It's like that. So, sometimes you definitely do need to go beyond the peer support that you have and actually go and seek for professional support and professional help, because every body is different and what may suit you could be totally different. That is one thing. Secondly, yes, please don't rely on Google. So I mean, if you go and search on Google a simple vaginal discharge, which could be just nothing, which could be just physiological, it will be listed everything right from physiological up to cancer. So I mean, that's something very, very, very commonly all of us doctors, all doctors are facing right now. People do a lot of their own research on Google and come, and they're already scared, or are they don't take certain things which should be taken seriously. So both things happen. So please don't always rely on Google. Google is always our best friend. Google auntie ko pooch sakte hai, but please always, I mean, you also need to I mean, make certain choices based on your body at times. That is something I would definitely like to stress upon. And one thing I would like to talk about, I two three questions on this point, which have been too many questions, so I can't take everything. But two three people have said about menopause around 40 or at 36 or before that. So this is what we call as premature or early menopause. And when I say that we have, as Indians, we have menopause around 5 years earlier than our Western counterparts, it also means that whatever changes that our body is facing because of menopause start happening little earlier in us. So if you're having menopause at an early age, maybe at 36, 40, um, you may be at risk for certain other issues, and you definitely need to take more care, or you need to start taking care a little early as well. So this is something which definitely requires some kind of help and medication. So please do consult for these early menopausal problems that you're having.
Thank you so much, Dr. Ramya.